At 6:23 a.m., the fluorescent lights in Front Range Military Medical Center flickered and hummed a thin electrical whine that pressed at the teeth. Dr. Maya Keaton pushed through the swinging doors, the chill of the surgical wing moving across her skin in a clean, sterile wave. Her auburn hair was braided tight and pinned the kind of neat that did not ask for attention. The stethoscope around her neck settled at the exact center of her sternum like it had found its own mark. She signed in at the OR desk. The pen moved in straight, economical strokes. No swipe of flourish, no hesitation. When she handed the clipboard back, the sleeve of her scrub top slipped just enough to show the ink on her wrist. A compass rose small black coordinates nested beneath it. Dr. Alistair Boone looked up from the central station. 52. Silver hair like a helmet you could set a tray on. He did not raise his voice. He never had to. It carried through the hub on its own. You are the one who did undergrad piecemeal, non-traditional entry, 34 for a first year. Maya met his eyes, pale green, steady. I took the long way. There is a reason most people do not, Boone said. He glanced at her wrist. The corner of his mouth lifted. Spring break or dare. It means something to me. I'm sure it does, he said. He slid a tablet across the counter with 2 fingers. Appy this morning. Straightforward. Specialist Noah Carter. 23. Take notes in the gallery. Maya scanned the chart. RLQ tenderness. Guarding. WBC elevated but not insane. CT red inflamed appendix. Vitals stable. Except the note in the history that snagged like a burr. Deployment to Kandahar 18 months prior. Weight loss. Night sweats. Has anyone ruled out retained foreign material? She asked, quiet like she was asking whether they had checked a door latch. Boone did not look up. Imaging is clean. Imaging misses small fragments. Pattern of the symptoms could suggest a walled-off infection that opens with manipulation. You have been a resident for 6 hours, Dr. Keaton. You can observe the surgery. Do not rewrite it. Jenna Park, PGY2, leaned into the nurse's station with a coffee and a small, satisfied smile she did not bother to hide. She was sharp in the way of second years, who had survived long nights and liked the sound of their own last names on the overnight whiteboard. Maya said nothing. She slid the tablet back. The fluorescent hum seemed louder. The locker room smelled like antiseptic and old coffee. She changed into blue surgical scrubs, tucked the compass out of sight. Her hands tied her drawstring with a tug and a square knot, without looking. Muscle memory lived there, quiet, practical. She touched the faucet with a wrist and felt the water temperature like a detail on a checklist. In the mirror, she looked like any other resident who could get replaced on a shift and the hospital would run the same. The gallery was cold. Glass on 2 sides, the theater below lit white and hard, trays already gleaming. A nurse counted instruments in the dry, precise cadence of someone who had counted their way out of anger before. Boone entered first, then Jenna, then the scrub nurse. Nate Rios stood at the far corner of the room with a calm stillness that made everyone else look like they were buzzing. Mid-40s, thick shoulders, forearms like cable. He did not stare at the surgical field. He looked at people's feet, at how they placed weight. They rolled Noah Carter in at 7'11". He had the flat, resigned look of someone who had been shouted at for 12 weeks in basic training and had learned to keep his jaw shut. The pre-op sedation softened his face, but his shoulders stayed drawn. A learned tension. A memory in muscle. The anesthesiologist did his checks. Skin scrape, drapes up, blue field, clean and crisp. Boone's voice through the intercom scalpel. Maya leaned forward against the rail, the glass cool at her hip. Boone's technique was clean, textbook, incision low and oblique. Layers parted. Exposure widened. The monitor at the periphery traced vitals in green and gold. It was unremarkable at first. Then the heart rate ticked 2 beats faster. Then 3. The blood pressure dropped a hair that would look like static if you were not watching it, like it was all that mattered. Jenna said something that did not carry through the glass. Her head tilted, eyes narrowed. Boone shook his head. The suction whirred. The irrigator hissed. The fluorescent lights hummed like a far train. Maya wrapped her right hand around the rail and found the same grip she used on a retractor handle without thinking. Her thumb settled on the same ridge her other fingers bracketed the tendons in her wrist, standing up. She did not mean to do it. It happened because it always happened when a body on a table started sliding toward trouble. Boone exposed the appendix and lifted it with a delicate hold that looked like an art photograph. Inflamed. Not ruptured. Attractive in the way clean disease could be. He nodded once to no one. Clamp, tie, divide. The vitals drifted again. 5 points down on pressure in less than half a minute, small sips off the top of a number that was supposed to be steady. The heart rate climbed another 6. Alarms blinked orange at the edge of the screen as if embarrassed to be dramatic. Increase fluids, Boone said, bored across the intercom. Anesthesia, keep him smooth. Anesthesia acknowledged. Another bag hung. The Venus line bobbed. Maya's breath was slow. She looked at the margin of the field, not at the appendix. She looked at the places Boone did not touch, at the dull sheen of the mesentery, at the faint contrast of tissue that had been quiet for months and did not like the attention. The smell was wrong for an appy like this. There was a low note beneath the iodine, a metal and old pus tone a person could only name after the 10th time they smelled it. Jenna's voice came sharper on the speaker. Abdomen looks tight, more distended than expected. Proceed, Boone said. Do not invent complications. Nate Rios glanced up at the glass. He did it once, then again, like the second look was to make sure the first one had been real. His eyes met Maya's. There was a tap of recognition there as clean as a handshake. He looked at her hands on the rail. He had seen those hands. Not hers exactly, but the way hands look when they have practiced in places without walls. The monitor chirped louder. Noah Carter's pressure fell in a smooth slide to 90/58. His heart rate slid past 118. The anesthesiologist said something fast. The OR lights did not change. Boone lifted the appendix off the field as if he were presenting proof of being right. There, he said. Clean removal, close. Maya stood up, her chair scraped. A med student 3 rows down flinched like she had shouted. She had not. She was moving for the door before she had decided to. The hallway outside the gallery was cooler than the gallery a draft slipping past the windows. She pushed into the scrub room, elbowed the faucet, and the automated soap dispenser hit her hands in a perfect pale ribbon. Inside the OR, Boone's voice lost a little of its weight. Where is the bleeding? Show me the source. Jenna's gloved hands searched. I do not see it. The appy is clean. Then why is he crashing? Maya's hands moved faster through the scrub sequence than the posted poster said to. Fingertips, webs, wrists, elbows. She did not skip steps. She did not linger either. The water ran clear. She backed into a gown. A nurse reached and tied her, startled, then efficient. Nate Rios was already there with gloves, thumbs stretched open, his eyes steady, as if he had been waiting for someone to ask him for something specific, and finally it had arrived. Boone looked up when she stepped through. You are not on this case. Out. Maya stopped at the edge of the blue field. The smell of antiseptic sat on the base of her tongue. Beneath it, the faint carry of old infection and metal. She kept her voice level-toned, the way she spoke to kids who would not ride the stretcher unless you told them where you were going. This is not hemorrhage, she said. This is sepsis. Peritonitis from a foreign fragment that ruptured its capsule when you moved the appendix. The OR paused a breath. The monitor went high and insistent, a bright scream that cut the thin quiet. The pressure posted 70/40 in green numbers that looked too small for a person that young. Boone said imaging was clean. Imaging misses small fragments. He deployed 18 months ago. Night sweats, weight loss. It fits. You cannot diagnose that with your eyes, Boone said. Maya held out her hand without looking at Nate. Her fingers opened the way her hand would if it were about to take a retractor that she liked. Retractor, she said. Nate placed the instrument against her palm. The steel touched skin, and it felt like a tool she had not picked up for a while and knew down to the gram. Jenna hesitated. Then she moved her hand 1/2 centimeter to make room. Maya looked at the field, not searching everywhere, looking at one spot. She pressed with 2 fingers, not hard, enough. Her expression did not change. Her shoulders did not tense. Her breath did not change. There, she said, and her voice did not rise for the word at all. Boone leaned in. I do not see anything. You will not. Feel it. She guided his fingers to the exact place. Scar tissue beneath the peritoneum. Encapsulation that did not belong there. A give that was not normal. The monitor sang again, bright furious. The pressure slid to 68/30. Nate had the irrigation ready before she asked. The specimen jar sat open like a small mouth. The fluorescent hum threaded the alarm in a rising weave of fine wire through a coil. Close him up, Boone said, automatic rote. Then he stopped as if the order had hit air that did not carry it. The alarm kept climbing. The numbers did not. The fluorescent lights kept humming. Maya's hands were already in the field. Maya slid the retractor into place and opened the field a degree. Her fingers went quiet, reading the tissue the way fingertips read Braille. Pressure here. A test there. Not a search across a continent. A walk to a known door. Irrigation, she said. Nate already had the bulb syringe in his hand. The saline ran clear across the peritoneum and pooled where it should not. The smell shifted under the iodine, a sour metallic note that seemed to stain the back of the throat. There, Maya said again softer and reached with a pair of debakis. The motion was small. She did not dive. She lifted. A whisper of fibrous tissue peeled, and something clicked in the forceps like a tooth on glass. She brought it out between steel tips, 3 millimeters across, irregular. Dark, with old exudate. It tapped against the specimen cup that Nate held ready. The sound was a pin dropped in a cathedral. Jenna stared. That was not on the CT. Imaging is a camera, Maya said. Cameras blink. The monitor screamed. Pressure 65/35, heart at 152. Anesthesia called numbers in a voice that had lost its evenness. Boone's shoulders tightened. Flush, Maya said. Lots. And start vancomycin and piperacillin tazobactam. You are not ordering antibiotics in my room, Boone said. I just did, said Dr. Samuel Adiemi from the control booth, his voice coming through like a calm tide. Pharmacy is releasing the dose. Keep moving. Nate irrigated. The cloudy wash ran and ran until it ran clear. Maya lifted a corner of the encapsulated pocket with 2 precise touches and let the fluid escape. The abdomen softened beneath her hands the way a clenched jaw loosens when a person finally exhales. Sutures, Maya said, which Boone asked already knowing he had seeded something that minutes ago he would have defended with a wall. Interrupted vertical mattress, she said. Nate placed the needle driver. Her fingers loaded the needle without looking. Her wrist made a tight, efficient circle. Through, out, tie, through, out, tie. The sound of the needle against the needle holder made a tiny rhythmic tap. The wall clock had the same pace, tick, tap, tie. Jenna kept one eye on the field and one on the monitor. 70/42, 78/48. The heart rate fell through the 130s to 120. The alarm shifted from screaming to nagging, then clicked off like a dog finally deciding not to bark at a shadow. Maya cut the last tail and looked at the field as if to ask it a question and wait for an honest answer. Dry it. Close the fascia. Skin with staples. He goes to ICU. Start the antibiotics now. People moved because they were told in a way that did not invite debate. The room filled with the small, busy sounds of competence. Gauze, stapler, label on a specimen cup snapped tight. The anesthesiologist checked a number and gave a dose and did not lift his eyes again. Boone stepped back. The white of his mask hid the set of his mouth. Where did you learn to palpate scar like that? He asked. His tone could have been accusation or awe. It wore either easily. Simulation, Maya said, and repetition. Nobody learns that from a mannequin, Jenna said, not unkind now, just landing on a truth she could not avoid. Maya looked at her hands gloved, wet steady. She said nothing. Noah Carter's number settled into ranges that made the anesthesiologist relax a fraction. The drapes came down. The body on the table looked like a person again, not a map. They wheeled him out toward a recovery. The OR lights stayed bright and blank as if nothing had happened. The fluorescent hum went on as if it always had. Maya stripped gloves and gown and stepped into the scrub room. The sink ran hot. Pink soap swirled toward the drain. In the glass, her eyes looked clear and too awake. The compass on her wrist stayed hidden under a damp cuff. Nate came to the next basin. He did not speak at first. Water on steel made a clean high sound that faded fast. Fallujah, he said. Second battle. The Navy had me holding retractors for surgeons who could find shrapnel with their eyes closed. You move like they did. Lots of surgeons move fast, Maya said. Fast is sloppy if you do not know where you are going. That was not sloppy. Jenna pushed through the door, her mask loose around her neck. She leaned against the tile with both hands like she wanted to feel something stable. That was extraordinary, she said. She searched for a better word, failed, and stayed with the one she had. I have never seen anyone find a foreign body by touch in under 60 seconds. Boone missed it completely. He was not looking for it, Maya said. The imaging was clean. Most of the time, this does not present as an appy. He was doing what he was trained to do. Jenna watched her. How many times have you seen this exact pattern? Maya shut off the water. The faucet squealed at the end of its turn. Enough, she said. I need to check on the patient. Adeyemi appeared in the doorway as if the hallway had cast him there from motion. He looked at all three of them as if he had filed separate pages in his head for each face. Mitchell is stable, he said. Or Carter. The chart says Carter. Pressure and heart are back up. He is on his way to ICU. He will do well. He looked at Maya. I would like to speak with you in my office. Am I in trouble? She asked. It came out lighter than she felt. Adeyemi tilted his head. That depends on what you call trouble. My door is open. He left them with the sound of his shoes on linoleum. The scrub room took back its humid quiet. Jenna stepped in closer. I do not care what you were before this morning, she said, and it sounded honest. If you can show me how to do that, I will listen. Nate dried his hands with a paper towel like he had all day to do it. He did not look at Maya when he spoke. I looked for your name in the places I know to look. There is no Dr. Maya Keaton in any military record I can see. That does not mean you were not there. It means either you did not go by that name or somebody put a lid on your file. Maya kept her eyes on the drain. You are making leaps. I am making observations, Nate said. Different animal. He dropped the towel into the bin with an accurate flick. I have seen 100 talented surgeons. None of them move like you just moved unless people were bleeding on the floor when they learned. The overhead speakers broke in on the room with a dry click. The voice that followed had no air around it. Trauma alert. All available personnel to emergency. Mass casualty event. RTD light rail derailment near Fitzsimons. Multiple critical. ETA 4 minutes. The words changed the air. Boone's voice called assignments from the hallway outside the scrub. Park Bay 1, Adeyemi Bay 2. Residents to me for distribution. Clear all non-emergent transfers to county. Jenna straightened. Her competitive smile was gone. She was already moving before the speaker finished. Maya stepped into the corridor. The hum of the fluorescent lights had faded under a new sound, the far-off keening of sirens rolling in a layered chorus. Nurses pushed gurneys into place with a rhythm that felt practiced and fresh at the same time. The charge nurse's radio crackled and spat. The triage board wiped and filled again. At the supply alcove, Maya reached for kits. Without looking the way you reach for things you have reached for so many times, your hand knows the shelf. Chest tubes, cricothyrotomy set, rapid infusion coils, tourniquets, tape. She stacked them on a metal tray. Nate slipped in beside her and took half with a nod. Their movements fed each other no wasted steps, two metronomes clicking into the same beat. You have done this, he said. So have you, she said. Boone cut through the hall with the velocity of a man who expected to be obeyed, and would be. Park Bay 1, Keaton. You are with me until I split you off. Adeyemi direct triage. We are taking initial wave here, overflow to north. Keep the trauma bays hot. He looked at Maya for a fraction too long, then looked away. His eyes held a line he had not drawn for her before. Doors blew open on their hinges with the first rush. Paramedics shouted vitals like auctioneers. Diesel exhaust rode in on the cold air and pushed past the smell of alcohol and plastic. A teenager on a backboard choked and snatched breath while a medic held an oxygen mask to her face and tried to get a pulse with fingers that were not sure which arm to pick. Bay 3, Boone said, pointing without looking. Let us see the first 4. Everyone else hold for assignment. Maya and Nate slid their trays to the side of a gurney and made space for the paramedics to lift. Hands counted, 1, 2, 3, and over. The monitor bloomed numbers. The oxygen readout quivered red, then orange. The siren from the next ambulance hit the glass of the air bay like a tuning fork and set it humming. Outside light bars threw red across the white tile and turned the ceiling into moving water. Inside the ward took a breath that was not a breath at all, more a choice to gather and spend everything it had. The teenager on the backboard had a bruise blooming along her left ribs and a high-fast panic in her eyes that made the oxygen mask look too big. Her breaths were short and sharp like she was sipping air through a straw that kept kinking. 2 lines, Maya said. Monitor, give me numbers. Nate hung a bag without asking. The screen popped to life. Oxygen saturation 84 and sliding. Blood pressure 92/60. Heart rate 138 and threaded tight. Neck veins, Maya said. The medic peeled back the collar. Jugulars stood up like cords under the skin. Trachea midline, the medic said. Dr. Alistair Boone leaned over the foot of the bed long enough to hear the numbers, then pointed. Bay 4 for now. We need space for the next wave. Maya palmed the girl's shoulder, grounded her. I know it hurts. Keep your eyes on me. The girl blinked hard. The mask fogged and cleared. Her chest rose unevenly. The left side lagged and barely moved. Tension pneumothorax, Maya said. 14 gauge, prep second intercostal midclavicular left side. A nurse snapped open a kit. Alcohol hit the air clean and sharp. The cold made the girl flinch. Maya found landmark by touch, dropped the needle to skin, went in on a single smooth trajectory until the resistance changed. A rush of air hissed through the catheter. The girl gasped. The monitor climbed from 79 to 86 to 92 like it had been waiting for permission. Good, Maya said, chest tube tray. Nate locked the needle and swapped in the tray with a tilt of his wrist. He nudged the scalpel handle into her palm. Tiny incision, hemostat through the muscle, a pop she felt in her hand. Finger sweep. The tube slid in with a small glide. Air bubbled in the underwater seal, and the tension in the girl's face loosened like a knot cut free. Jenna Park leaned in with a drape. Securing, she said. Her voice had lost that easy arrogance from the morning. It sounded clean. Behind them, doors hit again. More gurneys, boots on tile. The charge nurse called out colors. Red for critical, yellow for delayed, green for walking wounded. The traffic light of disaster. A man stepped through the chaos and did not wait to be told where to go. Late 50s, civilian jacket over a ranger straight back. He held a gauze pad to his forehead with one hand and carried his own pain in the other like it might spill if he moved wrong. The cut on his head was small, a line more than a slice. His eyes gray and watchful took in the room and slid past everything he did not consider urgent. I am fine, he said to a nurse who tried to steer him toward a chair. Maya kept her hands on the chest tube and watched him out of the corner of her eye. He favored his left side. His breaths were shallow in a way that had nothing to do with lungs. He slowed down for a heartbeat as if to listen to his own body. Name, the nurse asked. Thomas Rourke, he said. He did not add rank. He did not have to. It hung around him anyway, an old coat you did not need to see to know. Sit, please, the nurse said. He started to answer, and the words turned into air. His hand slid off his forehead, and the gauze floated down like a feather as his knees gave. He dropped straight to the floor. Code blue, someone said. It did not sound like panic. It sounded like an order. Boone arrived at the same time Maya did. No pulse, he said. Bag him. Pads on. Rhythm check. Maya put the heel of her hand on the sternum, found the line, and started compressions. The beat in her shoulders aligned with the clock, not fast, not slow, exact. 30. Breathe. 30. Breathe. In the corner of her vision, the teen girl breathed through her tube and blinked tears out of her hairline. A tech held the tube and murmured numbers in a low, steady cadence. The monitor at Rourke's shoulder showed electricity that did not match life. Not a systole. Not a clean fibrillation. Something trapped. He walked in on his own feet, Maya said. No blunt trauma to explain a sudden crash. He is guarding left. Age and history scream it. This is not an electrical problem. It is mechanical. What is your diagnosis? Boone said. His face was unreadable. His voice was not. Cardiac tamponade, Maya said. Migrating shrapnel punctured the pericardium, and he has been bleeding into the sac until the heart cannot expand. He needs a pericardiocentesis now. Ultrasound here. 16 gauge in a syringe. You are guessing, Boone said. I am reading the presentation, Maya said. Give me the probe. A new voice appeared by her left elbow. I have it, the voice said. A woman in student scrubs hair pulled back clean eyes that did not flinch. Her badge said observer. Her stance said something else. Lexi Morales, she offered quick and quiet. I can run the probe. Boone looked like he would argue. Dr. Samuel Adeyemi spoke from the head of the bed. Use her. Move, please. Lexi gelled the probe and slid it under the xiphoid. The screen flickered into black and gray and then into a shape everyone in the room recognized, even if they had never seen one before. The heart small and squeezed inside a black halo. Large pericardial effusion, Adeyemi said. He did not raise his voice. He did not need to. He locked his eyes on Boone and then on Maya. Maya kept compressions going. 30. Breathe. 30. She felt the sternum give and rebound, the small ache start in her wrists and move up her forearms. She kept the count. Do not shock him, she said. He needs a needle. Boone hesitated a fraction long enough to be human. Then he nodded once. Do it. Nate already had a long needle with a syringe. He clipped the cap without taking his eyes off the screen. Maya took the instrument and set her hand at a familiar angle at the subxiphoid space. She watched the monitor. The needle appeared as a bright line and moved toward the dark lake around the heart. Lexi adjusted the probe until the view was perfect. "You are in," Lexi said. Maya pulled back on the plunger. Dark blood filled the barrel. 100, 150, 200. The monitor shifted from chaos to a rhythm with a shape. The heart on the ultrasound inflated like a bellows. "He has a pulse," Jenna said. Her fingers were on the carotid. She sounded almost surprised, and then she did not. She just sounded sure. Rourke dragged a breath past the bag, and his eyelids fluttered. He coughed once as if annoyed. The room exhaled as a group. Sound returned like someone had turned up a dial. Boots moved. Monitors chimed. A teletech announced a blood pressure of 104/70 that sounded like a gift. Boone stared at the ultrasound still open in Lexi's hand. "You called that before we imaged it," he said to Maya. "Experience recognizes patterns," Maya said. The words came out plain. She did not decorate them. Lexi looked from the needle in Maya's hand to the compass tattoo mostly hidden under the cuff of a damp scrub sleeve. She took a breath as if she had decided something at a distance and finally reached it. "I saw your hands in Kandahar," she said. "FOB Wolverine, July 19. 8 casualties. No power. Sand and everything. Interrupted vertical mattress with combat spacing. I watched you do it by headlamp on my platoon sergeant, and I have not forgotten those stitches for 5 years. Maya did not speak. Lexi spoke into the space where denial would have gone. "Major Maya Keaton, United States Army Medical Corps Special Operations Command, combat surgeon. I know it." Nate lifted an eyebrow like he was marking a box he had left blank until this moment. Adiemi looked at Maya and did not blink. Boone's face lost something rigid in it. Rourke's eyes opened the rest of the way. He looked at the ceiling once, then found Maya's face. He tried to sit up and failed. He grimaced instead. "Kandahar," he said in a voice that arrived from far away and landed where it needed to. "Different tent? Same hands?" "Do not move," Maya said. "You need surgery. There is a fragment too close to the right atrium. We took the pressure off. We did not fix the hole." Boone tore his gaze away from the screen. Or one he said to nobody and everybody. "Get it open. Call cardiac. Notify blood bank." He looked back at Maya. His mouth softened at the edges. "This is your case." The words landed without fanfare. They did not need any. Maya nodded. She looked at the compass on her wrist, then up. Nate was already moving to the door. Lexi wiped gel from the probe and set it down with care. Adiemi stepped aside to let the gurney through. They rolled Rourke toward the elevators. The ER swallowed the space they left and filled it with other alarms. The boy with a splinted femur moaned. The teenager with the chest tube asked for water. Someone called for another unit of O negative. Somewhere a phone rang and stopped. Maya kept one hand on the rail of the gurney and the other on Rourke's shoulder. His skin was warm under the blanket, warmer than it had been. The elevator doors opened. Stainless steel reflected a square of faces that were more tired than they looked a minute ago and did not care. Upstairs, the lights along the OR corridor were cool and steady and did not flicker. The air had a bite to it that most people called clean. A masked tech held the last door open with a hip and did not meet anyone's eyes because she was thinking about the drapes that needed to be perfect. The room took them in and made space like a lung filling. Boone looked once at Maya as they scrubbed. He did not ask the question he had wanted to ask all morning. He only said, "Let us work." They scrubbed in without a word that did not need to be said. Water pounded steel. Soap slid off wrists and pink ribbons. Maya kept her eyes on the line where skin turned to glove. The compass stayed under fabric. Or one was colder than the hallway. The lights cut clean white circles into the air. Metal lay in ordered rows that made their own kind of silence. The cardiac anesthesiologist checked his circuit and nodded once. Boone stood opposite Maya and set his hands on the table edge, ready to assist. Jenna Park took retraction. Nate Rios stood at the Mayo stand instrument sequenced in a way that told you what would be needed before it was asked. "We will control inflow," Maya said. "Zone 1 balloon, 45 minutes tops." Boone nodded. He looked at the wall clock, set a timer. Nate was already placing the sterile drape and exposing the right groin. "Scalpel," Maya said. The skin opened with a sound like a whisper. She dissected to the femoral artery with the calm of someone who had walked this path often in the dark. "Heparin ready," she said. She nicked the vessel's slid in a 7 French sheath, then a wire that found its way like a fish knows a current. The catheter followed. On fluoro, the bright line climbed the aorta to zone 1. Inflate, Maya said. The balloon filled. The waveforms on the arterial line changed. Perfusion to the lower body stopped by design. The timer on the wall clicked to 45 Hauser and began its slow walk down. Sternal saw, Maya said. The saw wind up. Bone dust lifted into the air and mixed with the iodine and the faint sweetness of cautery. The sound ran through the bones of their faces and lived there for a breath. Maya split the sternum clean, placed the sternal spreader, turned the crank, and the ribs opened with a low, patient creak. She incised the pericardium. Fluid had already been drawn earlier. The heart lifted into view, beating under a film of moisture, pink and tireless. There, Jenna said softly, voice close to the field, right atrial wall. Maya saw the small dark glint embedded near the sulcus. 3 millimeters. Old metal. It sat like a burr that had waited 6 years for the wrong bump. We remove it, Maya said. It will bleed. We have 15 seconds to close before blood makes the field useless. Running polypropylene. Continuous stitch. No breaks. That is not enough time for a standard repair, Boone said. He did not argue. He listed a fact. Then, do not do it. Standard, Maya said. Retract. Jenna gently changed the angle. The atrium came forward into a perfect frame. Nate lined up the instruments close to Maya's right hand. Needle driver, fine forceps, scissors, suture in a loose half loop. On my count, Maya said. Pull when I say, hold when I say. No other words. She set the fine forceps on the metal and eased. It resisted a fraction and then let go with a small, ugly slide. For a beat, the field looked clean, and then blood welled fast, red and dark and insistent. Now, Maya said. Her left hand lifted and steadied. Her right hand moved. The needle went in. It came out. It moved again. The suture drew a line across the tear that held back a flood not by force but by exactness. There was no extra motion. Her wrist stayed low. The needle took the same bite, each time evenly spaced the way footsteps sound the same on a track. Boone's eyes were on the clock without meaning to be. 8, 10. He kept count because he could not keep from it. 13, he said. Maya tied the knot with a snap that made the bleeding stop as if someone had reached in and shut a valve. The field cleared. The suction took the last smear of red. The atrial wall held. Check for additional tears, Maya said. She ran a finger along the repaired line and then in a slow circle where thin tissue meets vein, the heartbeat under her touch with a steady insistence. Nothing else. Deflate, she said. Nate let the balloon down. On the monitor, distal waveforms came back. The timer had 29 minutes left. Warming blankets went onto both legs. The anesthesiologist adjusted gases and volume. A perfusionist in the corner exhaled through his nose in a way that sounded like relief, pretending not to be relief. Close the pericardium loosely, Maya said. Sternal wires ready. They wired the sternum with clean, even turns. Metal clicked against metal. The clamp bit and held. The saw was gone. The smell of cautery smoothed into the general scent of antiseptic and skin. Boone did not move for a long second. He looked at the small metal fleck in the specimen cup, as if it had made a promise to do harm and then failed. He lifted his eyes. They were not cool. They were not warm. They were present. Nice work, he said. Thank you, Maya said. They closed in layers. Fascia took stitch. Subcuticular closure ran neat under the skin. Staples set a clean silver line that would hold through transport. They dressed the wound. Machines went quiet except for the soft, constant hiss of the ventilator. Maya stripped her gloves and stepped into the scrub room. The water ran and took the heat from her hands. She felt each finger come back to itself. The adrenaline fell out of her shoulders. Boone came in behind her and set his hands on the edge of the sink, like it kept him from saying too much at once. He looked at her in the mirror. Who trained you? He asked. The Army, Maya said. Special operations. 6 deployments. He nodded once. It looked like acceptance and it looked like apology. Both fit. Adeyemi appeared in the doorway, mask hanging around his neck. He held a chart that he did not read. Colonel Rourke is stable, he said. Pressure acceptable. Rhythm stable. He will go to ICU when anesthesia finishes their checks. Jenna leaned on the opposite sink. Her eyes were bright with what she had just watched. That closure, she said. I timed it without meaning to 13 seconds. Practice, Maya said. Nate dried his hands and gave a small half-smile that looked like recognition. Combat spacing, he said. The words sounded like a memory and a rule at the same time. Boone took a breath. Administration will ask questions, he said. So will I. Not here. Not now. The patient takes the front of the line. Maya shut off the water. She looked at the compass under her cuff as if to check that it had not moved. It had not. She turned to the door. Nurses moved the gurney past them with a smooth, practiced push. Colonel Rourke lay under warm blankets color better than the ER eyes half open now and tracking. He found Maya and held her with a look that had a lot inside it, and none of it had to be spoken then. They walked with the gurney down the hall. The lights overhead ran in a straight line and hummed. At the ICU doors, a monitor beeped 3 times in a pattern that sounded almost like a laugh, and then settled back into a steady count. 4 months later, the old conference rooms on the north wing did not look like themselves. The carpet was gone. The walls were white and clean. Overhead, the lights hummed and held. The Front Range Trauma Simulation Center ran on a low roar of compressors pumps and the muffled chatter of a dozen different drills. Maya stood in front of the mock OR with a tray of gauze and a suction wand. The residents sat on step benches, blue scrubs, in a shallow bowl of light. 6 of them wore the square shoulders and careful calm of people who had worn uniforms before these. Damage control, Maya said. It is not pretty. It is not perfect. It buys time. She lifted a soaked pack from the pelvic model and the smell of saline and rubber washed out across the room. You do not hunt first. You pack first. You find it when the field lets you. She pressed 3 stacks of gauze into the pelvis and felt the pressure spread. The suction sang a thin, steady note. Her hands moved fast but not rushed. The wall clock clicked a soft beat above the glass. Tick, tick, tap. The residents watched the cadence more than the motion. On the first run, Team A froze for the length of a long breath. The mannequin bled from a hidden source that made the red spill look like a trick. They looked at each other. They fumbled with the tube tray. Then their training found a foothold. They moved. Pack. Clamp. Call for blood. One voice started to rise through the noise. The room shifted into the shape of work. They spilled out into the hall, sweating through scrubs when the scenario ended. The air outside the bay was cold enough to lift the hair on forearms. Maya stood with them where they caught breath. What did you notice, she asked. A first year with a ranger tattoo at his shoulder said I waited for someone else to tell me. That wasted 10 seconds. What next, Maya said. I will count out loud, he said. Even if I am wrong, at least we move. She nodded. Her eyes were not soft. They were steady. In Bay 2. Jenna Park ran a thoracotomy drill and did not look like the person who had smirked in a scrub room 4 months ago. Her voice had a core in it that people leaned toward. Hands on the rib spreader, she said. Feel the frame, not just the hole. Good. Now open the pericardium clean. Nate Rios ran a table along the wall with field dressing kits and tourniquets. He showed a resident how to pull slack on a windlass until the skin blanched and then hold pressure without shaking. His hands did it once and then guided the resident's hands over the same path. He did not say much. He did not need to. Dr. Samuel Adiemi watched from the back with his arms folded and a notepad in his palm that had not gained any ink. He listened for the way the residents started to talk to each other. He caught mistakes the way a net catches small fish and released the ones that did not matter. 2 visitors with Pentagon badges sat with Boone in the small glass office that overlooked the bays. One had a parted haircut and a clean tie. The other wore heels and moved like a person who had spent years at forward bases and never forgot where the exits were. We have watched 3 sessions, the woman said. Her eyes stayed on Maya's hands through the glass. We would like to talk about what you are doing here. Boone opened the door and let the hum of the room wash over the office. He did not introduce titles. He said, Dr. Keaton, can we borrow your time after the next block? Maya nodded and went back to the residence. She pulled down a laminated photo from the board at the front of the room. It showed a field where the air was dust and the sun turned everything flat. A tent, a plastic table had lamps. She did not name the place. Pack the whole quadrant before you unpack anything, she said. Let the blood tell you when to stop. Then go back slow. You are not building a house. You are stopping rain through a hole in a roof long enough to find the leak. Lexi Morales slipped into the second row in a clean white coat that still creased at the back from the hanger. She waited until the end of the block and then moved down. There was a letter poking out of her coat pocket that had the hospital crest on it and a date in July. "I am in," Lexi said. She could not help the smile, but she kept her voice low. "I start with ER, then trauma." Maya tucked a corner of the letter back into the pocket before it fell. "You will not stand at the back long," she said. Lexi said I learned to stop waiting. They stepped to the side as Team C carried a mannequin past on a gurney. The simulated blood dripped into a catch basin. The pump made a soft clicking that sounded like a metronome cut into small pieces. Boone's shadow fell across the two of them. He did not wear a mask. He looked more tired than the room allowed for and did not pretend otherwise. "I owe you," he said to Maya. He left the rest of the sentence off. The silence filled it in with the right words. "We are working," Maya said. He nodded and turned to the Pentagon pair. "This is the work." They watched in quiet as Team D cut into a chest and opened the pericardium without tearing it. Adeyemi signaled a compression. The resident leading did not hesitate. He moved like he trusted his hands. Colonel Thomas Rourke showed up during the last block with a cane that he did not lean on much. He stood in the doorway and watched the mock, or the way a man watches a river that once carried him and did not drown him. His suit fit. His color was back. He held a photo in one hand. Two girls with matching grins leaned on his shoulders, hair and sun cheeks full of summer. He gave the photo to Maya without comment. She looked for 2 seconds, folded the edge with her thumb like she was pressing it into a memory, and handed it back. Noah Carter came in behind him in fatigues with hospital clearance on a lanyard. He waited for a lull and then stepped to the front of the room like a person walking up to a mic in a room full of strangers who are not strangers at all. 4 months ago, I was on that table, he said. I thought I was getting my appendix out, and I woke up to a story about metal I did not know was inside me. He looked at the residents where they sat. Do not assume the picture in front of you is the whole thing. Listen to the person who sees the corner you missed. He stepped down. He did not milk it. He moved aside as the team reset the room. The Pentagon visitors met Maya near the glass door with a stack of papers they did not push into her hands. The woman with the heels said, "We would like your input." She did not say how much. She did not say how fast. She left a card on the ledge and did not watch to see where it went. Maya tucked the card into the breast pocket of her scrub top and walked back to the center of the room. The last block started with a quiet she liked. Not silence, readiness. She took a breath. The fluorescent lights hummed their dry hum. The wall clock lifted its second hand another notch. Her fingers touched the cuff at her wrist. The compass sat under cotton, steady and useless unless you knew how to read it. The first alarm that cut through the room came from the ceiling speakers, not the SIM consoles. It had a tone the building saved for when everything else needed to get out of the way. The charge nurse's voice rode in clean. Trauma alert, all available to emergency, multi-casualty inbound, details to follow. No one moved fast for a heartbeat. Then the motion began. Carts rolled, trays snapped shut. Residents who had hesitated at the start of the day moved with decision now. Jenna was already at the door. Nate handed off a stack of kits with one hand and clicked a light off with the other. Adeyemi's eyes cut to the triage board on the wall that did not have any words on it yet. Maya did not speak. She pushed her sleeve back. The compass ink showed and held. She set her palm on the stainless rail of the door as if she were checking that the building had a pulse. Then she walked. The hallway outside was bright and white. The air turned cold and tasted like rain before rain. The hum of the lights ran with them. Their steps fell into rhythm on the tile. Tick, tick, tick. The doors to the ER opened and the sound lifted and spread a field of work rolling into place. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.